Hi, Dr. Erin O'Maley here, and today I want to talk about a condition that is so common in our society today and so often at the root of neck and shoulder problems, and it's called upper cross syndrome. And a better word might be an adaptation rather than syndrome, because really what it is an adaptation to our lifestyle, the way we move when we're at work usually, or anytime, anyone who works in a forward position or plays video games or anything like that, we end up moving, away from our normal alignment under gravity to this kind of forward flexed, shoulders rolled forward position. And the longer we're here, over time, we end up staying here and we walk around like this. And it looks pretty weird, and it can contribute to a lot of painful conditions and eventual injury. So upper cross syndrome is just the general term for the most common pattern of postural imbalance and muscular compensation that we see in our society today. Everybody is different, but this is the general pattern. So if you have any issues with this, I'm going to show you some exercises that can help reverse this pattern, because moving chronically like this is much harder on your body. It increases the weight of your head on your spine, leads to more neck degeneration because your spine's not taking all the load, all the weight of your head the way it should be. It's also a very weak position for the shoulders to be in and move in, and can increase the risk of injury. The first exercise I'm going to show is called wall angel, and it's actually a really good way to screen to see, if you're having these issues, or, if you are, how bad they might be. So if you could see my feet, you'd see that they are about 2 inches away from the wall, and I'm pressing my belly button to my spine, keeping my low back pressed against the wall. And then the next step is to bring your chin back and bring your neck in perfect alignment, your head flat against the wall, and then your elbows up to level with your chest, and then bring the backs of your hands against the wall while maintaining that flat low back. Now, a lot of people will not be able to do this. A lot of people won't be able to get their neck back and will only be able to come about to here. And if that's you, then that's a really good indicator that you need to be doing this exercise. And eventually, you'll be able to work your arms all the way back to the wall and maintain that flat low back against the wall. Now, once you're able to do this, the next step is to then move your arms up and down the wall slowly while feeling the muscles at the lower borders of your shoulder blades engage and pull your shoulders back in the position that they are meant to be in. And from the front, it's going to look like this. And you want to feel those muscles at the lower borders of the shoulder engage, because what happens in upper cross syndrome is that, when you're at a desk a lot, chest muscles, the pecs, get very tight and keep your shoulders forward rolled like this. These muscles struggle so much to bring the shoulder blades back, but they get lengthened and can develop a lot of very tender points. Now, the other thing that happens in upper cross syndrome, and why it's called upper cross syndrome, is because it's a pattern of weak muscles, tight muscles, is that these neck flexors become very weak and allow your chin to jut out like this. And they're not stabilizing the neck, they're not doing their job, so these muscles are very stressed and tightened and shortened, and it can cause, a lot of neck tension and a lot of tension in the upper traps. So an exercise you can do to strengthen the neck flexors is with this band, and we're going to be trying to bring the neck back in alignment with the spine. Now, what a lot of people do when they're trying to bring their neck back is look up instead, and we're not looking up. We're just bringing the chin straight back into proper alignment, trying to bring the ear right over the joint of the shoulder. So to give some resistance, I'm going to use this band and just kind of hook it right at the base of the skull. And then it's just bring the chin straight back. And that's going to strengthen these neck flexors and take the stress off the posterior neck. If you do about 10 to 15 reps of these, 2 sets, and do this consistently, you're going to see and feel a big difference if you've been having any issues with upper cross syndrome. Thank you so much for watching. I hope you found this video helpful. Remember, if you do have a desk job or are doing any work that keeps you in a prolonged position, get up every 20 to 30 minutes, stretch, do your exercises, take a break, and then come back to it. So until next time, take care, be well.